as most of us know in this room, the older you get, time becomes kind of fluid. And stuff that I thought was like 3 or 4 years ago will be like 10 or 15 years ago. It's kind of embarrassing. But I do remember like it was yesterday when I first learned about REN. I went the South Carolina Women's Rights and Empowerment Network. I was super excited because there really wasn't any advocacy for women's issues at all. And this seemed like a really serious, like they're really going to do this. Like they're coming all over the state and they're organizing it. And it was very exciting. And we are so blessed to have them. The REN, the South Carolina Women's Rights and Empowerment Network, was founded in 2015 and they're based in Columbia. They're a nonpartisan, nonprofit organization working to advance gender justice, economic equality, and health for women and girls across the state. Ashley Lidow is the Chief Strategy Officer for REN, where she leads the organization's policy, advocacy, and community engagement strategies. A seasoned policy and advocacy leader with more than a decade of experience advancing gender justice in South Carolina, Ashley's been at the forefront of nearly every major policy victory since REN's founding. She has secured landmark laws and budget wins, including pregnancy accommodations, lactation and contraceptive access, paid parental leave, ending the shackling of pregnant inmates. That hurts me to say that. And the repeal of the sales tax on period products. Known for her ability to build broad coalitions and navigate complex political landscapes and speak to Republicans on a daily basis. Ashley brings together policymakers, partners, and communities to drive sustainable change. Ashley serves on multiple statewide and national advisory bodies, including the South Carolina Department of Social Services Advisory Board, the South Carolina Maternal Health Task Force, and the Board of Power Changing. She was also named a Riley Fellow through the Riley Institute's Diversity Leaders Initiative in 2023. Ashley holds a Master of Public Health from the University of South Carolina and a Bachelor of Arts in Molecular, Cellular, and Developmental Biology from the University of Colorado Boulder. Ladies and gentlemen, please welcome Ashley Lidow.
Thank you so much. I'm wondering how my sound quality is for everybody in the room. Can you hear me well? Oh, I see thumbs up and head nods. I love enthusiastic people. The person who just introduced me said, my name is Ashley Lidow. I use she, her pronouns. I'm the Chief Strategy Officer for the Women's Rights and Empowerment Network, REN, and I'm actually one of the original staffers. So I have been here since the beginning, and I'm very proud to have been here this long with our organization. So just a little housekeeping, I am going to share my screen to show you a little slide deck and then also to walk you guys through our website because it's going to be the way that I teach you how to fish for the information rather than just talking at you. And then if you do have somebody at your laptop to help guide questions as potentially I talk, it would help me. I'm going to keep it up. Just in case you need me to slow down and stop talking. So when I first was invited to come speak to you all, I was asked to show you what we produced in the fall of 2025, which is the Status of Women and Girls presentation, and give you a legislative update. So I am going to try to do that in 20 minutes, which means I'm going to give you the highest level of something. And my biggest goal for us, our 20 minutes together, is for me to show everybody in your room where all this information lives on our website, because I'm actually not showing you anything that isn't just publicly available. We try to make it really accessible for you. All right, everybody ready to rock and roll with me on sharing screens and going through presentation? Give me a thumbs up. I'm relying on the room to be ready. All right, so I am going to share my screen and I am really transparent, so you really get to see all of the things. And let me open. So you can see a slide deck, yes?
Yeah.
Oh, amazing. We'll go into presentation mode so it's big and bright and beautiful. So again, we published the Status of Women and Girls in South Carolina to make sure that our local communities could have conversation starters. So we did a very large report that summarizes the entire state as a whole. And then we made sure to do individual county reports so that you'd have your own individualized data. So as you are talking to elected officials or just having community conversations, you can understand just just kind of basic data points that are happening in your community. And again, this is meant to be a starting point conversation with us because at Ren, we actually want to build out policy agendas that are based on community level data, not just surface level research that I do in a silo. We want everything to be informed by your lived experience. So we present you with some data, and then we ask that you provide us feedback on what it really is like being implemented on the ground. So what we learned. Obviously, South Carolina women are facing big challenges. You just heard a lot about International Women's Day and a lot of stats, so you already feel that with me. But we have really big opportunities, and you heard that in some of kind of my quote unquote accolades as policies that I've won. But we can make change here, and I have seen that in my tenure here at Ren. I've shepherded that forward, and that is all of us working together. So we know that economic stability is out of reach. Maternal and infant health needs our attention. Childcare is in crisis. We need to make sure that we're getting safe and stable housing. And we know that this actually varies zip code by zip code. So again, nothing new to anybody, but I wanted to make sure that the data is matching your lived experience. So again, writ large for the state, 1 in 3 households can't afford their basic needs. Okay, this is like housing and food and childcare. Childcare is infrastructure. If you cannot get access to childcare, you're not going to work. If you're not going to work, you're not getting paid, and you potentially aren't also getting health insurance. So it is a building block for your entire life if you have young children. Women, especially Black and brown women, are overrepresented in low wage jobs and underserved by safety nets. And as we heard again in the previous talk, the federal administration is doing more and more cuts. Our state is very reliant on federal dollars. We are in budget week here in Columbia, so that's where I'm talking to you from, is Columbia, South Carolina, our capital. And the majority of the money that they're talking about is actually federally matched dollars. We only put a little bit in and get a lot down. Well, as the feds are making more and more cuts, that means our state is going to have to fill in the gap, and we don't have the money to do it. We do not have the revenue. Most of the conversations I've had as I am trying to fight for social programs like childcare, like SNAP, is that the money is not there, and it's going to have to be families having to quote unquote figure it out because the state can't step in. So that's part of the innovation that I have been trying to do as a policy person, is to figure out, well, if the money is going to go away, where do I find new money and revenue streams? But that's a talk for us building new policy together another day. But I wanted a little snippet of what I do every day. And then again, the divide between rural and urban counties are huge with inequities, especially with the way that our dollars are spent related to transportation and schools. So again, with South Carolina as a whole, we have one of the highest maternal mortality rates in the country. Black women are 4 times more likely to die from pregnancy-related causes, and typically this is postpartum hemorrhage after birth. So time and again, this is access to healthcare and also racial bias within the healthcare system. So people being believed when they have an issue at hand. Many communities, oh, I heard a stop. Does anybody have a question before I keep talking? Or just in background noise from your piece?
Yeah.
Okay, just wanted to check. Okay, so many communities lack access to OBGYNs, midwives, and hospitals, and there's many policy conflating factors that lead to this. But I will say that the abortion legislation, we just had the Reproductive Health Advocacy Day, and right after was also the ACOG, which is the American College of Obstetrician and Gynecologists Advocacy Day, right after. And the heads of their residency programs listed to legislators and staff and myself, because I was in the room, that as they're doing recruitment, the state's restrictive abortion bans, and then the continued restrictions on other medical care, like trans health care or access to healthcare for minors, which is an active conversation right now in the state, is making them not choose the state to come to. So we have currently 17 counties without an OBGYN, and we are at risk for losing more and more as our restrictions increase. Because why would you want to spend your entire life training with medical care and then coming to a state that wants to treat you as a felon for doing your best practice. And I can understand that. It's hard to convince the students who are sitting right in front of me to stay with me here in South Carolina and fight when they just want to treat patients and not have to worry about being sent to prison. So, like I said before, childcare is in crisis. One of the facts that we like to point out, but we don't like the fact, is you're supposed to, when budgeting for your family, the right dollar amount is around 7% of your income for things like childcare, and most families are spending about 28% of their income on childcare. And that is only growing if you have more than one child that needs that. So again, childcare is out of reach for many folks. And when we have conversations at the State House, they say that we do not have the money to help supplement, like getting more family scholarships or to give relief to providers so they can open more spaces. And to that I say, well, then let's find the money together. Again, there are crises in front of us, but if you can point to what the problem is, we can start building a solution. And that's what we do here at Wren. And that's what I hope to do with you all. So finally, safe and stable housing is scarce, so rent is increasing and our minimum wage is not. And so basically, we have really high rents that cannot keep up with what the current job market is offering for wages. And we also have one of the highest eviction rates in the nation. So we partner with housing justice groups to try to help folks get to affordable housing and to potentially clear their eviction because not being able to pay 1 month's rent shouldn't cause you to be excluded from any sort of housing situation in the future, which it potentially does in this state right now. So we're trying to get eviction ceiling records here in the state with partners so that families potentially who had one bad month aren't locked down for the rest of their lives and not being able to get to a housing situation. So you know this, I'm going to keep skipping so that I can get right to Greenville. So again, I will say if you have a cell phone, you'll see at the bottom of my presentation a QR code. This gets you to our landing page for this entire report and shows you every single county. So I pulled this from our county fact sheet for Greenville so that you have the data right in front of you. But if you wanted to take a little snapshot, it's always going to be available at the bottom corner of my slides. So again, these are just your basic demographics of your county. 66% white, 19% Black or African American, and 11% Hispanic or Latino. We don't have the data amounts for those who are indigenous at this time, but always looking for better data. For the maternal and infant health, you have a maternal vulnerability index of 42%. So this is what I use to try to figure out how vulnerable your county is to the poorest of health outcomes. So you're doing better than most counties. So the higher the vulnerability score is, the more vulnerable your population is. So again, you're at 42%. We'd love to get you to a 0%, obviously, but you do have access to OBGYNs and other social supports that help improve maternal and health outcomes. And that's detailed in your county report even further than this. Again, access to care. Typically in your county, a pregnant individual only has to travel 2 to 7 miles on average to go to a facility. That's incredible compared to other counties. Some counties have to travel hundreds of miles to be going. So you have full access to care, meaning there are 2 or more hospitals or birthing centers and at least 60 obstetrics providers. So obstetrics is the practice of delivering babies. So again, really happy for those metrics for maternal health and infant health, but again, we'd always want to work to improve that, especially in relation to the insurance access that people have to getting to those. Overall, you got in your presentation before that in South Carolina, women earn about 79 cents to the dollar compared to men. That is an inflated number because it's all women put together. So I like to point that out that white women are really raising that number higher up. And then when you go further down, it's actually only 58 cents for Black women and I think 46 cents for Latino women. So really, white women are raising that dollar amount up, and we really do need to look at the racial disparities, not just the gender disparities. And then in Greenville County, we were able to find that women earn on average 76 for every dollar earned by a man. So you're lower than the state average. So again, medium income is on the bottom, and these are things that we need to truly address. And it's not just wages that impact a wage gap. It is people's ability to actually access high paying jobs, and then for us to do comparison of what job titles are. So sometimes you'll look at a janitor versus a housekeeper. They're doing the same skills, effort, and responsibility, right? Like think about it. They are pulling the trash, they're mopping the floor, they're cleaning the space. But because the names are gendered, they're potentially sometimes put in different categories and they are paid differently. So if one could be paid 25 an hour versus 15, but when you put skills, effort and responsibility next to each other, that is something that we are highly focused on here at Wren, is to make sure that there is parity in those things rather than just job titles. So something for you to look at if you run a business or potentially are in an HR role is to right size your organization, look at your skills, efforts, and responsibilities, not the job titles. And you'll find that a lot of things that are gender roles are skewed off, and you could make change within your own, do advocacy within your own organization as potentially deemed fit, or in your local community for anybody who is working. Okay. Greenville in relation to housing, food, and education. So 13% are experiencing instability. With food, there is 12% of the population facing food insecurity. 65% of school-age children qualify for free lunch. We at Wren are really proud to have joined alongside with Wholespire, an amazing nonprofit in South Carolina that is working on food insecurity. And we actually this past May, so May of 2025, were able to pass it was Senate Bill 425, and it required that school districts that qualify for a federal program that would pay for free breakfast and lunch, right? So accessing those federal dollars that we qualify for, that passed in May, and so now we're at 80. I'm trying to remember what he told me the other day. I think 86% of school districts that are qualified have applied because of the law and are providing free breakfast and lunch. So like my daughter, who's 6, goes to Forest Lake Elementary School here in Richland 2. Richland 2's poverty level is at the place where we could accept it. So no matter our family's income, everybody at school, starting at 7:20 in the morning, gets a free breakfast. So she goes through the car line, I drop her off, she goes, eats her breakfast, and then at lunch gets a free lunch. And so it's a really incredible program, and we are working towards a long-term goal of getting folks access to all schools free breakfast and lunch. But in Greenville, you have 65% of school-age children that qualify, and your school districts are opting into that program. So very proud that we're feeding the kids in your county. And then for education, 90% of adults in your county have at least a high school diploma. And 80% of families live below the poverty line despite the low, or 8%, excuse me. Ooh, 80 would kill me. Of families live below the federal poverty line despite your unemployment rate. So you have jobs, but are they paying enough for people to not be in poverty? No, they are not. So I'm going to keep it rolling. What does it look like for childcare in Greenville? There are 156 childcare centers, averaging B minus on the ABC quality ranking. You have fewer than 60% enrolled in quality childcare program, and you have 57% of students that are entering kindergarten who are considered not ready for school. So again, high access to high quality childcare is school readiness. We always are myth busting with policymakers and those who don't understand the system that childcare is not babysitting. The first 5 years of your life are the most crucial for your brain, and a high quality childcare center is what's going to get you ready for your learning for your rest of your life. Your annual cost of childcare for an infant is $9,000. Again, that's in-state tuition here at USC, just so we're having apples to oranges. A toddler is 8,700 and a 4-year-old is 8,200. And yes, we have 4K here in the state, but it's needs based. So not every 4-year-old qualifies to go there. And that's also an expansion that we would look towards as we look towards going for universal childcare for all. And that is our goal here at Wren. I am looking for revenue sources to try to figure out how this state gets really high quality access to early childhood education that we currently know as childcare so that every child has the same strong start, not just the children whose parents can afford to go to certain places. Okay, this is a very long recap, but overall, you have really strong economy in your county, and we need to make that economy really work for your families. We need to make sure that you are not having stressed working parents that are looking at opportunities to work, but having to work 2, 3 jobs just to make their income. And we need to make sure that all of the social supports are insured for those who aren't currently making income requirements to make their basic needs. So you can give me even more feedback, aka you can help me build our next policy agenda by answering this. If you scan this, and you can do this online too. So if you go to our landing page, it has it. But I am using all of these conversations to get your brains just really juicing and going and flowing on what's happening in your local community so that you can provide us feedback. And so I can come and even ask more kind of targeted questions to specific issues and build out a policy agenda for all of us rather than what this data says. So I would love for anybody who is willing to go ahead and scan that QR code or save it in for later. Give me the feedback. And then also making sure that you go online, and that's where I'm going to go to next. So don't be shocked when I exit this piece where you're going to see my browser. I'm going to show you online where this really lives. Okay, so you scan with your QR code, but I like to teach the people how to fish. I use our website every day as a staffer. I audit it as well. I mean, that's what my job is as chief strategy officer, is to make sure that this is user friendly. But you can see this is our homepage, scren.org, and you can see advocacy resources. I'm going to first go to what I just talked about, status of women and girls, and scroll down. Yeah, go ahead.
Yeah, this is Laura. I'm gonna let you take a breath.
Okay.
You probably need it. Just to let everybody in the room know that I'm sure there are a lot of questions. There are index cards on your tables and pens at your tables, so please write your question down. And then when Ashley's done, members of the board will come collect them and bring them up to me, and we'll get them asked and answered by Ashley. So just want to remind people to do that. And now that you've had a chance to take a breath, now you're back.
And you always have to pause me because I love a soapbox. I have the confidence of a mediocre white man. I will talk all day. Okay, so on to I want to make sure that you see this. We do all of our reports, everything, English and Spanish. Okay, we were always providing any of these pieces, and we want you to also use this. So these are all available for you to download. You don't have to sign or do anything. They don't cost you anything, but our full report is on here. And then you can scroll down, right? And then you saw my slides. Oh, wow, nothing new. It was my same slides, right? So you could get your snapshots. If you're ever doing presentations or doing any of that, you can do it here. And then we also have the clickable map. And I'm not going to pretend like I know how to click Greenville on that clickable map, but we can do the drop-down menu, click, and then you can get your report in English or in Spanish. You see I've downloaded it. You can also see that I was doing admin work earlier. Enjoy my Excel spreadsheets. Well, it's going to load. I want to make sure I show you exactly what's going to happen for you. And then let me pull this over to my screen that I'm sharing. So see, you'll be able to download it. And I want you to use this as much as you want to use this in any of the work that you're doing. If you are an adjunct professor, if you're doing letter writing parties, if you're writing testimony to something, if you're going to a Greenville County Council meeting, anything that you want, please utilize our data. And we are going to do our best to every year update this for y'all by county so that you have those pieces. But again, we have it in English and in Spanish, and we have it for every county. So also if you're just coming to meet everybody in Greenville, but you're actually not from Greenville, or you have other sister Democratic women organizations or that, you can bring them here to do any of those pieces. Okay. So that is status of women and girls and the resources I'm trying to make sure that I get to you. And then we're curious about your feedback. You can do, again, at the very bottom, you can go and give me feedback in English or in Spanish on a form. And I really, really need this. Like if you're looking at the report and you're like, I want next year's report to have XYZ, put it in this feedback form, okay? This is going to help us build. You are part of our REN network. That's it. We're not a membership fees based piece. Like you are our community. I want to know what you need. Okay. And then again, with utilizing status of women and girls, before I go to a legislative update, I want to go to advocacy writ large in our resources. I really want you to know that we built out a toolkit that's evergreen that you guys can use without any issues attached to it. But we did this again in English and in Spanish so that you guys could go anywhere in your community and do what you need to do, okay? Whatever thing that you need to do. If you wanted to figure out just how to influence as a foursome in Greenville, the county council, well, how do I build a power map? Well, these are examples of what a power map is and how you build it in English and in Spanish. They are literal worksheets I wrote with our team so that you can do this work, hopefully alongside us, but also without us. I am always trying to work my way out of a job so that each one of you is a leader in your community and you don't need to call on me for any change that you want to make. Again, all of these are on here. It explains how a bill becomes a law. It's got just a legislative glossary. So if you're even reading the newspaper and you're like, I have no idea what it means to adjourn debate, you could always come to our REN website and just look up what that means. You also always can email me or Katie Titilio on my team, and we will always answer your question about what something means. If you're planning a trip to the State House, we have practical guides. I'm telling you, maps with even parking locations about where there is places you can go, tips on how to talk to folks, where they're having meetings, all of that located here. And so I just really wanted to highlight that on our website so that because this is such a quick like interaction between me and y'all, that you know that we built this out for you. And then we do monthly webinars. We make sure that we download them to YouTube. So those are here. They're great resources. If you ever wanted us to come speak, not just to your group here, but into any of the other auxiliary groups that you're a part of, we have an invitation to speak. And then we're always collecting stories. And those stories, with your permission, are what drive change at the State House for me. I literally open up our story collection database as I'm lobbying and use them as examples for legislators about why we need to change a policy based on lived experience in different counties. So the more stories I have in the bank, the more I'm able to influence legislators based on what their individual constituents in their counties need. And then finally, I will make sure that you know that we put all of our basics about the bills that we're working on here in this priorities section. So I have two basic priority areas for our organization: economic justice and reproductive freedom. So if you're ever like, I wonder if Ren's going to work on that, that's the lens that I always use to make my decision of whether or not we weigh in. And we are not just weighing in on most of the policies. If they're in priorities, I probably had a hand in help writing this piece of legislation to put forward. So we know a lot of the background, but you can open it up. You can get fact sheets in English and in Spanish, read the entire bills, and take direct actions. So again, I wanted to give you highest level before I run into just like the quickest buzz of a legislative update and then open up for questions. I'm really going to try to keep myself tight on this ledge update, but this is my like bread and butter. So this is where you really have to stop me from getting on a tangent. On our website, if you're ever missing, every Monday we put out our weekly updates. It shows you what happened all of last week and then forecasts what we're working on into this week. So it helps kind of temper you in time. We put those, if you aren't already subscribed or aren't following us on social media, where we also put the slide decks, insights. So every weekly update that I have is uploaded right here, right? So this week's is here. This is why I didn't make you a slide deck, because it's already gonna be right here in this weekly update, and I'm just gonna put it bill by bill and just talk through it with you. So last week we had amazing movement on a bill that we're working on with the ACLU, and actually an organization called Pro-Life Greenville, which we're typically at deep odds with. And then plenty of other organizations have come out in support, like Children's Trust and the Catholic Diocese of South Carolina. But this would support early pregnancy screening for people who are coming into custody. So not only jail systems, but also so corrections and local county jails, and really anybody that is being processed by police, ensuring that they're getting an early pregnancy test. And then if it is a crime that would not make them a explicit danger to community, allowing the judge to have discretion on if they could serve their term as potentially under parole or house arrest, so they can stay connected in with their family and community, and not be in that really severe setting while they're in their pregnancy and postpartum coverage. We worked really hard on that anti-shackling legislation in 2020, and we put prenatal care in there as an amendment. If you remember Senator Meta McLeod, one of the sister senators, she worked really hard to take, so it was Nancy Mace's legislation when she was in the SC House that we worked on it with her. So she has done something here in the state. Got to give credit where credit's due. She was as wild back then as she is now, though. She did the initial anti-shackling, but Mia McLeod is what made it so good in our state in the Senate side, and got access to menstrual care and prenatal care in the jail system. But it's still a very kind of traumatizing scenario. I don't ever want to go to jail. I can't imagine any of you want to, and I can't imagine doing that as a pregnant person away from my family as I'm going through all of the like basic needs of getting ready for a child. So this would be the next step in that iteration of supporting pregnant people in our state. And so it's a balance between their time needing to be served for the crime that they committed, with also balancing maternal and infant health of that population. So it went through full committee and is going out to the Senate floor. So this is one of those really nice movement forward that is trying to help maternal and infant health outcomes. And we've had only positive feedback so far. And we've had the Department of Corrections and the Sheriff's Association and the Parole Board and just really the whole community that might be touching this all at the table as one large coalition trying to figure this out. So again, bipartisan support. It has not gotten a nay vote yet, so it goes out to the Senate floor. And so we may see some discussion starting this week, though we were told that a couple of technical amendments are needed. So I don't know that it's going to be fast rushed through the Senate, but just giving you this. Then last week we also had a child rollback, child protection rollback bill move forward. This is a really unfortunate bill that takes away a family court's ability to weigh things like gender expression, gender identity, kind of against a parent or a foster family. In trying to figure out the best situation for the child. So if you start denying, say I'm a foster family, and I start denying a foster child who says that they feel non-binary, and I start taking them repeatedly to a church setting where they admonish and say that God doesn't believe them and all that, which is it doesn't rise to the level of an abuse standard in the state, right? I can't report them based on statute, but over time, psychologically, it is doing a very harmful piece over and over again. A family court judge couldn't use that for replacement in a foster system. Same if I was going through a custody battle. My husband and I get a divorce, and Vera starts saying that she wants to go see a therapist to talk about her gender identity, and then I show the family court judge that my husband does not believe her, or if Vera wants to use they them pronouns, the judge couldn't then weigh that in our custody battle of which household is more supportive of the child. So again, we call it a rollback of child protection because family court judges are trained and have been doing this very well, case by case, in all of these family settings, and it's truly just to target the trans community because it's only about gender expression and giving a carte blanche positive immunity to those who want to deny trans existence. So we are fighting against that, and it will be in a full committee. It wasn't on this week's full committee agenda, but we do need people to vote no against it because it can sanction child abuse. Moving forward, we had a bad IVF bill this past week. So it was presented to everyone in the House as if a positive reproductive health bill that helps people with infertility. But what it is, has anybody ever heard of a crisis pregnancy center? So pregnant, scared, you've ever seen those billboards that are trying to drive people away from actual clinics into kind of religiously motivated counseling? This is the IVF version of that, where it's called restorative medicine. So if you're going through infertility, they give you kind of woo-woo infertility advice that does not include IVF, and they do not counsel for IVF because they don't believe in it. And so they'll try all of these other pieces, and they wanted to divert state Title X funding from family planning into talking about this. So trying to divert the very limited dollars we have right now into false science, and that would drive people away from IVF. And every minute counts with your fertility, as many of you may know. My eggs are finite within my body, and if I need to address getting through the cycles of extracting them for the IVF process, then I don't need to wait cycle to cycle to cycle and listen to drug science for a year before I figure out that I need to go to a real fertility clinic. So all that being said, there is a really great coalition of us that work on reproductive health in the state, including IVF providers, and they don't separate themselves from the abortion debate. So I have been working with them for over 12 years. It's all one and the same of trying to build families in what is most supportive to that family's experience. And so in deep connection with them, they did amazing pre-work with the subcommittee and the sponsor, and testified in the subcommittee this past week. And they were able to adjourn debate and are having private conversations with the sponsor that this legislation can't move forward. And if she truly supports IVF, they're going to hand her supportive policies. So that was also one of those wins where you do the work, you do the education, and somebody actually listened. And so that does still happen in this state. It feels like we get a lot of hits, but I do like to point out when it is working. So I still want you to oppose that bill if you're taking actions later on. Also
And
last
actually-
week, yeah, go ahead.
I think we should move on to questions if we can, unless you have a big bill that you really.
The final thing I will tell you is the new hot sexy that I'm seeing, which is my final bill on here. You have heard a lot about parental rights. I'm very sure of it. When we have started having the parental rights conversations related to contraception, I am reading the tea leaves that the far right is ready to start taking their bite and taking away contraceptive access to people under 18. I've already seen the legislative debates, and I need to foreshadow that for all of y'all, because it's guised under the fact that parents should have control and consent. Not every family is supportive of their children. They're not, and then not all children are even comfortable in a supportive family to talk about these things. And so if we remove the current standard of how you can consent to reproductive health care, we may see a huge rise in our already rising STI rates, and we may see a huge rise in our teen pregnancy rates that we worked 20 years to reduce by increasing contraceptive access. So that's I need everybody to be on their P's and Q's related to parental rights. I am all in for parental involvement. I am also very much knowing that if you can menstruate, you can become pregnant. And if this state is going to allow you to be a parent, then you should be allowed to consent to getting birth control as well. Because the bills say that if you give birth or you need prenatal care, then you can consent. Well, I think you need to be able to consent before your entire life makes a different turn, and do the preventative care. And so I wanted to make sure I say that. Senate Bill 710 is one of those pieces, and then there is the other parental Bill of Rights. Just keep asking inquisitive questions of your local lawmakers about whether or not they want to reduce teen pregnancy rates, or reduce abortion rates, uh, for people, because it's really the next conversation I see coming. So that's that's the last thing I wanted to say.
I do. Well, while we're picking up any questions that we have, raise your hand if you've got a card with a question. A couple over here. I just want to say, you have the most complete website I have seen in a long, long time. So you should get a big round of applause for maintaining that. Okay, well, we do have questions. I have a quick one to start with. When you say that the state doesn't have the money, you're really saying that they don't want to spend the money on these things, right?
Right.
No, if we do the tax conformity, we are going to bottom out. We could, I'm telling you, they're trying to eliminate the amount of taxes that we have, and they're pushing the line with the federal matches with certain bills that we could not qualify for a lot of it. So say this pieces with, um, there's some childcare bills that want to redefine something. Well, we can't draw down CCDF money if we decide to use our own definitions. We have to use theirs. So if they pass that policy, we bottom out. If they do both the income tax and the tax conformity, we are potentially only playing around with $200 million instead of $1 billion with a state budget. I'm telling you that we have to all be watching the dollars amounts because they are great election headlines. And everybody, I mean, I also wonder my tax dollars, right? But of where they go and how they want to be spent, and I would love more money in my pocket. But the return on investment of social programs, like I want my money to go to childcare. I want my money to go to free school lunches. I want my money to go through, right? And so that's the part that's not marrying. We are giving money out to corporate tax breaks. Okay, we're giving Scout Motors and Boeing and all them sweet deals. Why do you think we're the economic drivers of the South? They're not paying back to our state. They're not paying their fair share. So again,
That's what I'm saying, though.
there's
We have-
but there's truly not the money if you're looking at the fixed budget amounts to even fund all of our agencies to the funding requests that they have. To do the bare minimum.
So another good reason to have more years of Republican dominance when they can't even do the one thing that they say they can do, which is handle the money. It's okay. So Ashley, how many requests do you get to do presentations for Republican women?
For Republican women, I usually have to insert myself into those scenarios. I don't get invited to like the GOP Republican Women roundtables, but I do get invited to policy spaces that are issue specific that definitely go more conservative, and have to have tough conversations because I'm not shy about my support to abortion access. I mean, abortion
Yeah.
is a good thing. Abortion is healthcare for me, and I don't kowtow to that. But I mean, Republican legislators invite me to come speak to their town halls. So it's kind of that mixed bag.
Wow, that's good, actually. Yeah. Let's see, how do members of the state legislature justify ending the income tax? Okay, I think you just answered that question, ending the income tax. I don't know whose question that was, but I think she answered it. What
Well,
if they
I
pass?
hope I did answer it, but it should be self-explanatory. It's an election year. They're trying to look good on who cut the taxes. It looks good on a mailer, okay? Because most people don't know how to do that high-level budgeting, and they don't know how the money ebbs and flows. And they don't realize how much around us is paid through public dollars and how much they rely on it.
Right.
Like they don't, if they're not on Medicaid and they're not on SNAP, they don't think that the public dollars aren't helping us. But every road I drive on is actually state, like 70% of our roads are owned by the
Right.
state. Like it's wild.
Right. And what percentage of our state budget is actually federal money that is not necessarily coming in as expected. So if we pass the SAVE Act, and the person who wrote this didn't specify the state SAVE Act or the federal SAVE Act, but if we pass this, how do we vote if we don't have a passport or a birth certificate to?
Well, so it's going to be the federal. We don't have a version of the SAVE Act here in this state. That's actively like in threat. The federal one is a threat. And all of us who are working on the ground are going to have to work twice as hard to figure out how we get the passports. And then we have to work with litigators to see if they could stop it. But if we don't get ahead of it legislatively, right, if it passes and we're not all taking the actions and we're not putting the screws to them, we on the ground have an obligation if we want to try to save ourselves from the SAVE Act is we would have to start doing clinics to see how we can get people access to passports and all those pieces. And the hardest part is who has the money for that? Because it costs $100 and something to get a passport.
That's right. That's right.
Yeah.
Okay. Let me know if we have to do clinics. Well, then women will join you doing those things for sure. I sense an unspoken disconnect with the cultural climate of South Carolina. Ren targets legislators, but aren't most voters influencers attached to religious institutions? Shouldn't every church on 14 and Woodruff Road and Roper Mountain be educated about their empowerment opportunities for women in congregations?
So that's what part of these conversations are, right? So our role at Ren is to make sure that we are breaking down the barriers to conversations and trying to give y'all tools in the toolkit. I am not connected to any religious, just like me personally, I'm not connected to any religious denomination. My husband is Jewish, but is not as like tightly connected to the synagogue here. So it's not my place to go and speak to a church, but it's your place to go speak to your church, right? Because you are part of the community and you are that. It's my place to help you feel confident in that, to give you the educational tools like the Status of Women and Girls Greenville, like the toolkit for advocacy. And really, I always want to remove Ren as an organization as a pedestal, like the savior of the state. We're just a core component of the foundation with you so that we're all stepping forward together. So I hope that doesn't sound like a cop out, but more as a call in that I think that's a great idea. And I would love for you all to go to your local congregations to make that change happen.
That's a really interesting point that you make because we are probably, Den Women is probably going to have your advocacy training group come for another session in a month or 2 months. I gotta call Aisha and schedule that. And it might be a good time for people who are involved in their churches to maybe have a session that kind of addressed, how do you talk to your congregation about these issues and, how do you do it in a non-violent manner. Sorry, but I offended anybody. I apologize. Okay, Ashley, thank you so much for this amazing, incredible presentation. We did all we do all the time. Yes.
Thank you all. And again, you have feel free to share my slide deck, but I showed you how to use everything on the website. We keep it really up to date. And if it's not on there and you want it to be there or you have ideas, I am building all of this with you and for you. So please, as much feedback as you can give me as possible. If you need something, if you've got a story, if you've got a problem going on in local community, that's a lot of how all of the bills that are signed behind me got started, is local community members came to me specifically with stories about how it was impacting them. And then we pushed them all the way through the legislature. So again, thank you for your time. And I hope this is like one of 100 times I get to talk to you all.